8 Deep breathing exercises for anxiety reduction. Breathing is an essential part of our daily lives. It happens naturally and without thinking. Inhaling air allows blood cells to receive oxygen and then release carbon dioxide. Carbon dioxide is a waste product that is carried back through the body and exhaled. Poor breathing can cause disruptions in the oxygen and carbon dioxide exchanges, anxiety, panic attacks and fatigue, as well as other emotional and physical disturbances. Anxiety can be caused by shallow breathing. People who are anxious tend to take shallow, rapid breaths from their chest when they're stressed. Thoracic breathing, also known as chest breathing, causes a disruption in oxygen and carbon dioxide levels. This can lead to increased heart rate, dizziness, and muscle tension, among other physical sensations. This could indicate a stress response, which can lead to anxiety or panic attacks. Deep breathing, also known as diaphragmatic, stimulates the parasympathetic nervous system. This is responsible for controlling heartbeat, blood flow, and digestion. Deep breathing can help you avoid the fight or flight response to physically or mentally frightening situations. Chest versus abdominal breathing. Most people aren't really aware of the way they're breathing, but generally, there are two sorts of breathing patterns. Diaphragmatic, abdominal, breathing. This sort of breathing may be a sort of deep, even breathing that engages your diaphragm, allowing your lungs to expand and creating negative pressure that drives air in through the nose and mouth, filling your lungs with air. This is often the way newborn babies naturally breathe. You're also probably using this pattern of breathing when you're during a relaxed stage of sleep. Thoracic, chest, breathing. This sort of breathing comes from the chest and involves short, rapid breaths. When you're anxious, you would possibly not even remember that you're breathing this manner. The easiest thanks to determine your breathing pattern is to place one hand on your upper abdomen near the waist and therefore the other within the middle of your chest. As you breathe, notice which hand raises the foremost. Breathing exercises. The next time you're feeling anxious, there are a variety of deep breathing exercises to try. Alternate nostril breathing. Alternate nostril breathing, Nadi Sodhana, involves blocking one nostril at a time as you breathe through the opposite, alternating between nostrils during a regular pattern. It is best to practice this sort of inhaling a seated position so as to take care of your posture. Position your right by bending your pointer and middle fingers into your palm, leaving your thumb, annual eye, and pinky extended. This is often referred to as Vishnu Mudra in yoga. Close your eyes or softly gaze downward. Inhale and exhale to start. Close off your right nostril together with your thumb. Inhale through your left nostril. Close off your left nostril together with your annual eye. Open and exhale through your right nostril. Inhale through your right nostril. Close off your right nostril together with your thumb. Open and exhale through your left nostril. Inhale through your left nostril. Do your best to figure up to 10 rounds of this breathing pattern. If you start to feel lightheaded, take an opportunity. Release both nostrils and breathe normally. Belly breathing. According to the American Institute of Stress, 20 to 30 minutes of belly breathing on a daily basis will reduce anxiety and stress. Find a cushy, quiet place to take a seat or lie. For instance, try sitting during a chair, sitting cross-legged, or lying on your back with a little pillow under your head and under your knees. Place one hand on your upper chest and therefore the other hand on your belly, below the ribcage. Allow your belly to relax, without forcing it inward by squeezing or clenching your muscles. Breathe in slowly through your nose. The air should enter your nose and downward in order that you are feeling your stomach rise together with your other hand and fall inward, toward your spine. Exhale slowly through slightly pursed lips. Note of the hand on your chest, which should remain relatively still. Although the sequence frequency will vary consistent with your health, most of the people begin by doing the exercise 3 times and dealing up to 5 to 10 minutes, 1 to 4 times on a daily basis. Box breathing. Also known as four-square breathing, box breathing is very simple to learn and practice. In fact, if you've ever noticed yourself inhaling and exhaling to the rhythm of a song, you're already familiar with this type of paced breathing. It goes like this. Exhale to a count of 4. Hold your lungs empty for a 4 count. Inhale to a count of 4. Hold air in your lungs for a count of 4. Exhale and begin the pattern anew. 4-7-8 breathing. Relaxing breath is also known as the 4-7-8 breathing exercise. It acts as a natural tranquilizer to the nervous system. It is best to do the exercise sitting straight up. You can start to feel more comfortable with the breathing exercises once you are familiar. For the duration of this exercise, place the tip of the tongue against the tissue ridge behind your upper front teeth. Exhale completely through your mouth and make a whoosh sound. To count to 4, close your mouth and breathe in slowly through your nose. For 7 counts, hold your breath. Inhale fully through your mouth and make a whoosh sound for 8 counts. Lion's breath. Another helpful technique is Simhasana, also known as the lion's breath in Sanskrit. This involves extending your tongue and roaring like a lion. It is a great way to relax your jaw and muscles, relieve stress, and improve your cardiovascular function. This exercise is best done in a comfortable, seated posture. Spread your fingers as widely as you can. Breathe through your nose. Your mouth should be open. Inhale strongly and carry the breath over the root of the tongue. When you exhale, make a ha sound from deep inside your abdomen. For a few seconds, breathe normally. Repeat the lion's breathing up to 7 more times. Mindful breathing. Mindfulness meditation is a practice that involves paying attention to your breath and bringing your focus to the present. This allows you to be aware of your breath without allowing your thoughts to wander to the future or past. To inhale and exhale, choose a calm focus. This could include a sound, om, or a positive word, peace. Relax and let go. Take a deep breath, and if your mind is drifting, gently return to the present. Pursed lip breathing. Pursed lip breathing, a simple breathing technique, will make deep breaths more deliberate and slower. This technique is beneficial for people with anxiety related to lung conditions such as emphysema or chronic obstructive and pulmonary disease. Relax your shoulders and neck while you sit comfortably. Keep your mouth shut and inhale slowly for 2 seconds. For 4 seconds, exhale and pucker your lips as if you were giving a kiss. While you breathe out, slow down and hold your breath. Experts recommend that you practice pursed lip breathing at least 4 to 5 times per day in order to achieve the right breathing pattern. Resonance breathing. You can reduce anxiety by using resonance breathing or coherent breathing. Place your head on the ground and close your eyes. For 6 seconds, gently inhale through your nose with your mouth closed. Do not overfill your lungs with air. Inhale slowly for 6 seconds and let your breath leave your body. Continue for up to 10 minutes. Focus on your body and take a few extra minutes to relax. Simple breathing exercise. This exercise can be repeated as many times as you need. You can do it standing up, sitting or lying down. Stop if you find the exercise too difficult or feel panicky or anxious. You can do it again within a day, and increase the time slowly. Slowly inhale through your nose. Relax your shoulders. Your stomach should expand and your chest should not rise. Slowly exhale through your mouth. You can exhale slowly by squeezing your mouth. As you inhale, you may hear a whooshing sound. Continue this breathing exercise. Continue this breathing exercise for several minutes until your body starts to feel better. Deep breathing can be made easier by listening to your body. Be aware of how anxiety affects your daily life. Deep breathing can cause severe anxiety. If you feel this, consult a mental health professional. Before you attempt any breathing exercises, consult your healthcare provider if you have COPD, asthma, or are experiencing pain or difficulty with breathing.